Yeah, I'm Larry. I was diagnosed with prostate cancer when I was 57, which is coming up to 5 years ago. At about age 55, my GP gave me a standard PSA test. It didn't show up anything. It was quite low. Roughly every 12 months after that, I'd have another one, and it did jump quite a lot. So, to cut a long story short, after a couple of those tests, sent me off to a specialist, did a biopsy. Eventually chose the surgeon that my GP had referred me to. One of the great things that he did was refer me to do pelvic floor exercises before I had surgery. So one of the side effects from prostatectomy, especially radical prostatectomy, is you have basically problems with urination and sometimes with defecation, obviously erectile dysfunction as well. I had zero problems with defecation and I was dry from the get-go. That was a really good thing that the surgeon did in sending me off to do those exercises. So getting fit to me was a really important way of emotionally dealing with it, and I've only recently found out there's a potential link between exercise and cancer. Hot flushes, weakness, further decrease in libido 1 to 3 weeks after the first injection, when I noticed the significant loss in strength and speed. I didn't know that exercise physiologists existed until 9 months ago. What I was really looking for out of this program was somebody that had formal training and good understanding of anatomy and had linked that into not disease so much, but as linked it into specifically and targeted programs for particular issues.
It's targeted a lot to bone mineral density, the program that we're running at the moment. So we have a lot of exercise specifically targeted around the hips and the spine area, but it's also multimodal, so it's designed to address cardiovascular effects. So we've got cardiovascular exercise in there, resistance training, and power training too.
Niamh's got it very right in terms of giving an appropriate level of exercise.
It's so rewarding to see by the end of the program, or towards the end of the program, just the improvements in strength and vitality, and that what they report in terms of their energy and their sleep.
It's all about quality of life. I don't actually think it will extend my life. What it'll do though is extend a better quality of life for longer, because one day it's going to get me. So my motivation is to feel as good and as fit as possible, so I can do as much as possible for as long as possible, and that's why I want to be fit. To me, exercise should be just part of your daily or weekly routine. You really should be doing something 3 to 5 times a week, and when I don't have the energy. It's a weird feeling that the more exercise I do, the better I feel, and the more I feel like doing.
So for anybody who has a diagnosis of cancer, or anybody who's looking after patients who are diagnosed with cancer, our recommendation is that exercise be part of your treatment and you seek help from an accredited exercise physiologist.